Hello, everybody. Welcome to the Tuesday edition of Video Clips, and I hope you had a wonderful 4th of July. I did. I got some sun and some work done and celebrated our country's birth and independence and come back at everything with renewed vigor after a couple of days of out of the routine, right? A couple things I want to mention to you. First of all, the Food Over Medicine license program, our new program, which allows people to go through a training program and offer our memberships and products in addition to teaching you how to develop a directed services, teach cooking classes and pantry cleanouts and personal chefing and all kinds of things that you might be interested in doing to help people to adopt healthier eating patterns and improve their health that way. Two sneak previews, and also two things to think about. The sneak previews, one this Thursday, the 7th at 8:30, and one next Monday, the 11th at 7 p.m. Eastern Time. All of those are free. You're welcome to take a look, join us, and you can learn more about all of this. The other thing is that we're offering, it's half price the first time we're doing it, a little less than half price actually. So this is the time to do it if you're thinking about it. I'm happy to send you information. Just send me an email at pampopper@msn.com and I will send you some information and an invitation to participate in one of those sessions, all right? Second thing is, I'll remind you that August 2nd, I believe it is the first in the series of classes for the Nutrition Educator Program folks who are saying, boy, I sure would like to sign up for that program. It is so incredible, and it is. It is an alternative to conventional dietetics training at a university, but it's expensive and it's time consuming, and it is those things. It's a more expensive program and it takes some time and there's a lot of work involved. So we've graduated a lot of people who are doing wonderful things in the nutrition field, but I can understand somebody wanting to really think about it and know more before they sign up. So I'm teaching this sample class series. It'll actually be 2 classes from the program. So if you decide to enroll, you will have completed some credits. But it's a chance for you to see, do I want to be in school? Do I want to do homework? Do I like the style of teaching and all that? It's done through virtual training, Zoom and conference calls and that sort of thing. So you don't have to come to Columbus to do it. You can be any place on the planet. So if you're interested in knowing more about that, I can also send you some information. All right, so the topic of the day here, we're going to talk about knees and pain and all that sort of thing. And I'll just start by saying this. We all know that exercise is good for you. It reduces your risk of cancer and heart disease and type 2 diabetes. It can also help people to maintain normal weight or to lose weight, all important because being overweight is a contributing factor for almost all diseases, including severe COVID. There's sometimes a big disconnect between what humans know and what they do. I can speak for myself on that, right? Exercise is a good example. Now, I'm good on the exercise, but we all have something that we know we should be doing that we're not, right? I haven't met many people who defend being sedentary, but I have met lots of people who can give me reasons why they don't exercise. The most common, as many of you know, is lack of time. Another is disliking or even hating exercise. Yet another is injury. People will say, I would join a gym, take a yoga class, work out with a trainer or run, but my knee, shoulder, ankle, foot, neck, name a body part hurts. Well, what health experts often don't tell people, and sometimes they tell them the opposite of this, is the key to not hurting, if you've already developed some joint pain, is exercise and building a strong body. A new peer-reviewed study shows that walking can reduce chronic knee pain due to osteoarthritis for people who are age 50 or older. The reason is that walking actually slows the damage that occurs over time within the joint for the person who has osteoarthritis. In other words, if you're in pain, movement is the best way to deal with it, not avoiding movement. Now, in my opinion, some of the benefit had to be due to weight loss or preventing weight gain. I think we all understand that carrying too much weight results in increased pressure on knees, and studies have confirmed this. There are 2 ways in which being overweight contributes to knee pain. One is really direct. I mean, excess weight places more stress on weight-bearing joints like the knees. For example, when a person walks on a level surface, the impact on knees is 1.5 times body weight. This means that for a 125-pound female walking on a level surface, the knees will experience 187.5 pounds of pressure. But if a female who should weigh 125 pounds weighs 180 pounds instead, the pressure on the knees on a flat surface is 270 pounds, almost 100 pounds more. Every pound a person gains places increasing pressure and stress on the knees. The force is even greater going up the stairs, 2 to 3 times body weight, and 4 to 5 times body weight if you're squatting down to pick up something off the floor, for example. So those are direct ways and easy to understand. The heavier you are, the more downstream weight pressure your body is experiencing. The second way in which weight affects knee pain is that fat cells produce inflammatory cytokines, which increase inflammation and pain throughout the body, and this includes in the joints. Knee pain, and the reason you have to pay attention to it, you should pay attention to all pain, but knee pain can lead to compromised quality of life because people, as they get worse, sometimes can even find it difficult or impossible to walk. This leads to immobility and frailty, and it's often the main reason for commitment to a nursing home. Now, if there's anything we all should have learned during the past 2 years, it's that remaining independent and in our own homes as we age is really important for all kinds of reasons. Physical strength and mobility are the most important factors that determine the ability to do this. So the bottom line is get moving. I mean, you don't have to enter an Ironman competition or a marathon or win the Arnold Classic. You just have to move regularly, engage in regular exercise. And by the way, as this study that I quoted earlier shows, having pain is not a reason not to exercise. It's an important reason to start now so that it doesn't get worse. Pain is always a warning sign that something is wrong. I mean, if you have a broken bone, it means it needs to be set. Deep cuts may require stitches, and generalized musculoskeletal pain requires action too. Movement and weight loss, which is facilitated by movement, is part of the remedy. One thing I'll add to this is that sometimes there are alignment issues that put pressure on the joints as well that need to be addressed. And so if you're a member of Wellness Forum, hopefully you have taken advantage of the Office Hours with Eileen, our amazing, best in the country physical therapist. It's free, it's part of membership. She does a session once a month, and it gives you an opportunity to get to know her. And then you can decide if you want to do some remote sessions or take some classes with her to improve your own musculoskeletal health from an alignment perspective. So all kinds of membership benefits. Sometimes I think people don't realize that membership includes Q&As with me every month, Office Hours with Eileen, Ask the Therapist. One of our amazing therapists, Kylia Roba, does a session every month. It's free for members. So if you're not a member, you should consider joining, because this discussion topic today, which is pain, joint pain, would be one reason. This would be a reason to join so that you could speak with Eileen. So anyway, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you tomorrow with more news.